greatest wealth, words of Virgil. Welcome to ILERA EKO Extra. Yes, your one-stop shop for everything and anything health. Yes, health information that will, of course, help you access quality health care at very, very, very affordable price. My name is Akan Usen, your host, and today we're discussing a very, very interesting topic that I know you will definitely be you'd love to learn about and hear about. It's one we have been talking about for a couple of weeks. Of course, the show is powered by the Lagos State Health Management Agency, LASHMA, and they bring to you the Lagos State Health Insurance Scheme, which, of course, is ILERA EKO, popularly known as ILERA EKO. And lately, yes, in the past couple of months, a few upgrades have happened. Formerly, we had the standard plan, we had the standard plus plan, and a few other plans. But at this time, there has been a major upgrade. So we're talking about the ILERA EKO Standard JARA plan, which, of course, in my words, is, I will say, it's a comprehensive health insurance initiative by the Lagos State government, of course, through the Lagos State Health Management Agency, LASHMA. So the show will bring you all the information you need to know and everything you should know about this particular plan, which is the latest entry from, of course, LASHMA. And it has been carved out and, curated for you so that you can have access to quality health care. Do remember, if you have any question or concerns, you want to find out anything, feel free to connect with us, 080-991-20777 and 091-538-77127. The first line, 080-991-20777 is also our WhatsApp line, so we'd love to hear from you. If you have any questions, we'd definitely want to hear them, and we see how we can look into them. Of course, one more time, my name is Akan Usen. I will not be having any guests on the show today. We'll just be doing a bit of educating, getting you to know more about the ILERA EKO Standard JARA plan. Of course, as the show progresses, we would also be giving you very, very good helpings, healthy helpings actually, of traffic updates to make sure you are informed on the traffic situation in and around town. Alright, I have this one from the Okeodo axis just before I start doing a lot of talking. Yes, the Okeodo axis where we have good movements from Ajegule connecting Alakuko, Kola, Castle and Route Abulegba, but it gets busy around the spots, yes, the above mentioned bus stops due to high influx coupled with bus stop activities, pedestrian activities and commercial activities. However, structures very much on ground. We also have it busy from Abulegba connecting Ojaoba under the Jubilee Bridge on Roots Charity, but it gets better down to Abattoir. Super is good, but busy in what's illegal due to the nature of that corridor. Not forgetting bus stop, pedestrian and commercial activities. However, it gets better down to Pleasure, likewise the return journey. Overall, no record of any impediment, while we have traffic managers on ground within the zone, making sure things move as smoothly as possible. More updates coming. All right, so at this time, we just go into what we have to talk about. Yes, I was telling you that we're going to be talking extensively about the ILERA EKO Standard JARA plan, which I said is the latest offering by LASHMA. It's a comprehensive health insurance. They have looked at what's the feedback from the people who are on the plan, what they need, what they talked about, what is lacking, and they've been able to come up with this novel development, which of course was inaugurated by Governor Babajide Sanwo-Olu on the 16th of July, and it's a comprehensive health insurance initiative, which of course is aimed, like I said, aimed at providing quality and affordable healthcare services to residents. This plan was designed to address the healthcare needs of people of Lagos State, ensuring they receive medical attention they need, of course, without financial burden. The ILERA EKO standard plan offers a wide range of benefits. Now, you have one of those benefits. We'll talk about consultation packages, physiotherapy sessions, common ailment treatment, childhood illness treatment, eye care, family planning services, and more. With this plan, if you're on this plan, you can have access to quality healthcare services, ensuring you and your loved ones stay healthy. Because the truth is, nobody plans to fall sick. But when it happens, if it happens, an emergency, you will know that you have some sort of safety net, something to fall back on, and you can always get that much needed care and treatment as when necessary. Okay, so let's just go into more detail and talk about some things that you will enjoy. Yeah, talking about the benefit package. I have this one where, of course, okay. So I was telling you about the. Okay, yeah, I told you about the childhood illness treatment, eye care, family planning services. It covers outpatient care. Yes, so common ailments such as malaria, diarrhea, respiratory tract infections. All this is covered on that standard JARA plan. It also includes treatment for chronic illnesses like hypertension. Yes, those people who suffer from that ailment. Of course, that you definitely need you need to go for constant refill of your drugs and all that. When you're under this plan, this upgrade, you do not have to worry about constantly going to get your refills, because it will definitely be provided. Now, another a feature of the standard JARA plan is access to telemedicine services. Now, telemedicine services, of course, it entails you being the ability to being able to see a healthcare professional without having to go to the hospital, or being in the hospital physically. And for me, I feel that's a game changer. That's amazing. So you can be in the comfort of your home or any of the virtual booths. Yes, of course, we have the virtual booths which you could just go to and access medical attention. You talk to a healthcare professional, and you get to be attended to without having to go to a hospital. Maybe the hospital is far from where you are, or maybe at that very point in time where you need the medical attention, you just cannot access a hospital. So this is part of what you get to enjoy. So backtracking a bit, the benefits package, of course, registration, which everyone knows, general consultation, seeing a doctor, getting attended to, your blood pressure, your weight, temperature checks, your height. I also mentioned that specialist consultations, which of course, in this plan, you are limited to 4 visits. You can see general surgeons for normal surgeries. You can see the pediatrician, that's for the children, the ear, nose, and throat surgeon, and services of dietitian also covered in this package, gynecology for the women, family physician, cardiology for the heart, orthopedics for bones, physiotherapy, that's of course when it's medically indicated, and in this plan it's covered up to 5 sessions annually. So you see, this is these are things you get to enjoy. Also, I was talking about common ailments. Outpatient care is covered for things like common ailments like malaria and other acute, uncomplicated illnesses. Diarrhea, like I mentioned, acute respiratory tract infections, uncomplicated pneumonia, simple anemia. That's the one that you will not require blood transfusion. Simple skin diseases, other uncomplicated fungal, parasitic, viral infections, and all that. There's also cover for follow-up treatment of chronic illnesses, like I mentioned, hypertension, diabetes, sickle cell, asthma, and all that. You also, so first aid, yes, it also covers first aid for dog bites, snake bites, scorpion stings, and all the, minor things like that. So, with all this I've said, it just shows that this is actually quite loaded. For the children, for our children, they're also covered. Of course, I'll come to how many children and how much you have to pay. But just to let you know that, a few children, suffer from feeding problems, and all this is covered. Feeding problems, nutritional counseling, treatment of common childhood illnesses, e.g. malaria, like I mentioned, diarrhea, measles, upper respiratory tract infections, pneumonia, and other, children diseases that that are more happen more to children. Now, coming to eye care, we get this question a lot. A few people ask, okay, do I have what and what is covered? Now, so for eye care in this particular plan, as against the other plans for the standard plan that we had before and the standard plus, here you have treatment of minor eye ailments, including conjunctivitis, parasitic and allergic ailments, simple contusions, abrasions, and all that, and removal of conjunctival, non-penetrating foreign body, refraction, lens and frames. Okay, so if you want to get your glasses, you actually covered. As against the standard plan where it was just 5,000 naira, this one has a 10,000 naira limit, and some other surgeries that has to do with the eye, cataract extraction. Yes, for our elderly ones who perhaps have gotten to that age where cataract is a thing to watch out for, you actually covered in this plan. Pterygium is also covered for those people who listen to or who follow the station. You know about pterygium. If you listen to Eyes on the Road, you know what a pterygium is. It's actually covered. It can be removed if you're on this plan. Okay, moving ahead, family planning services is also covered under the standard JARA plan. So you can, you can go through counseling on the different family planning methods, provision of services like oral contraceptives, any other contraceptives, provision of services, emergency contraception, injectables, implants, and everything within that field. Family planning services is another feature that you have on the standard JARA plan. If you have any questions, you want clarification, feel free to connect with me. 080-991-20777 and 091-538-77127. All right, a quick detour to look at the situation of the roads at this time. I have a good view of the Gege Pen Cinema axis, where movement inwards and outwards of that on that bridge is looking really, really good. I can see for those moving inwards we have a call. Let's see if we can just quickly take this. Hello, good morning.
Yeah, good morning, sir.
Good morning, Mr. Yusuf Olamileko.
Good morning, sir. Yes, I want to attest to the fact that the standard JARA plan is very rich.
Okay.
You are still, I have to just cut in.
Yes.
You are still mentioning the benefits.
Yes.
You are not yet done.
Yes.
But in order to save time, I want to quickly add this.
Okay.
For those of us who are already on this ILERA EKO plan, that do express reservation and fear about when they visit hospital in the night.
Yeah.
Maybe before 8 p.m. in the night.
Yes.
And as an outpatient, maybe the GP now asks them to go to the community pharmacy to get their drugs.
Yes.
I want to assure them that it is now clear, from Rashma portal that
yes,
the hospital is to give medications, including outpatient medications, after 8 p.m. Every day and on weekends.
Okay.
So whenever your GP, asks you to go to, just let them know that the hospital, it is now mandatory that
it is now mandatory. Okay.
Yes, that they can now, the hospital is now to give them the drugs when it is 8 p.m. Anything beyond 8 p.m.
Yes.
Because for the community pharmacies, they should not be they might have
closed and all that. Okay.
So they can get it at the hospital. So to make it clear and to clear their fear.
Okay.
So that is because I myself I do feel the same before.
Okay.
But now I'm now clear that it is now easy for us that you can get it at the hospital.
Even
so that's
after
my
8
contribution.
p.m. Thank you so much, Mr. Yusuf. I do appreciate
welcome,
you.
Thank you.
Do have an amazing
You're
day.
welcome. Thank you.
All right. Yes, and just to clarify, yes, and thank you very much for your input, Mr. Yusuf. So beyond 8 p.m., you can still access, medication and all that from the. Oh, okay. I have another call. Let's see if we can take this. Hello. Good morning. Good morning. Hello. Hello. Good morning. Hello. Oh dear. Okay, we seem to be having a bit of difficulty hearing you. Do call back so we can get that call. Let's get to hear what you have to say. 080-991-20777. Still talking about the standard JARA plan before Mr. Yusuf called and, of course, gave a bit of commendation. And just to buttress a few points, hospital care and admission. So under the standard JARA plan, you're actually covered you're entitled to standard and general ward. You're covered for a single meal, but the caveat is where it's available. So you might actually you might have chosen a healthcare facility where such service is not available. But where it's available, you actually have access to that for 15 days cumulative per year. Okay, 15 days, that's like 2 weeks. Yeah. You're also covered for pharmaceutical care. So like we talked about, provision of prescribed drugs, which of course is in line with the LSHS drug formulary. And for those who need blood transfusion, yes, where an instance where perhaps treatment will require blood transfusion, 2 pints per year. So you are covered for up to 2 pints per year, and you're also covered for donor screening. So if someone wants to donate, you're covered for the screening. Now, for chronic diseases, under the standard JARA plan, there is coverage for screening and the diagnosis of diabetes, hypertension, asthma, osteoarthritis, treatment of diabetes, treatment of hypertension, management of asthma and osteoarthritis, and periodic routine investigations for diabetes and hypertension. So all this is covered. Now, moving along, being on the standard JARA plan, you're also covered for HIV/AIDS services. So there's provider-initiated tests based on clinical guidelines, referral to HIV referral centers for treatment, client-initiated testing, which happens once a year, HIV service charge, consultation and dispensing of medication, perinatal HIV exposure for a child. So all this, the drugs that will be needed to protect the baby in such an instance, is also covered. Now, moving ahead, we also have coverage for tuberculosis services. So sputum AFB for tuberculosis, referral linkages to designated treatment centers for treatment, consultation, counseling and dispensing of drugs. So medication for to handle tuberculosis treatment covered. We also are covered for hematology. So hematology, anything that has to do with blood, full blood count, resource factor, blood group, every other thing. We're not the experts. We're just letting you know how rich this plan is and why you should get to be a part of it. Clinical chemistry also covered. Random blood fasting, sugar, electrolytes, pregnancy tests, oral glucose tolerance tests, blood urea, liver function, all those kind of tests that you might need to do, albumin and all that. Everything is covered. So a lot of other tests, your urine, stool, blood, wound swabs, and every other thing. And yes, moving ahead, you're also covered for diagnostic radiological investigations. So talking about the x-rays, chest, limbs, abdomen, vertebra, and then echocardiogram. Now, but for the echocardiogram, you can only go for once a year. Now, still talking about tests, the diagnostics, you have the ultrasound scans, the test, obstetrics, abdomen, ECG, cervical, mammogram, and all this is covered. You will agree with me that this is so rich. Now, moving ahead, for the mothers and the newborn babies, antenatal services covered, prenatal, cervical, circlage, normal delivery, cesarean section is covered. Yes, you all know how much a cesarean section is these days. If you were going to pay out of pocket, you know, all this dilation and every process that has to do with, you know, the mother and the child born newborn is covered. Immunization is also covered. Circumcision, ear piercing. Yes, you heard that right. Perinatal care for the following conditions in the first 28 days. So incubator care for maybe a premature newborn is covered, but the limit is 5 days. Ophthalmia, neonatorium, phototherapy, and also all the other conditions that might happen to a newborn baby, you know, these are covered. Then we also have local ambulance services for like a maternity emergency from a primary care facility is also covered if you're on the scheme. Now, dental care is also covered. Scaling and polishing, oral healthcare counseling, non-surgical extraction, dental x-ray, composite filling, all this is covered. And then let's just going to mention a few minor and major surgeries, you know, incisions, minor suturing of maybe wound dressing, removing of a hernia, appendix, you know, all this POP application for simple fractures, all covered. So major surgeries are also covered, which you know, you just think about the major surgeries. Now, a few major surgeries are covered. Okay, so dialysis is also covered. Yes, I must say because it's not covered in some of the other plans that we had prior to this time. So dialysis is covered. So acute renal failure, 3 sessions actually is covered. And moving ahead, emergency care is covered. Telemedicine services also covered, like I spoke about. This teleconsultation services, you have physical access at the V booth. That's from 8:30 a.m. to 4 p.m. But if you want to call via your phone, the app, it's 24 hours. 24 hours, and the number to call is 080000 EKO VBT or 080000 03568828. There will also be mental health consultation and counseling still under the telemedicine services. Health education broadcast, advice, prescription for medication where available, and covered for cancer treatment up to 2 million naira. Yes, being on the standard JARA plan, but of course there's a caveat. You have to have been on the plan for a certain number of years. Now, you will ask me, even as we bring things to a close, how much is this? What kind of plan is this that has so much benefit? I'm sure it will cost me an arm and a leg, but no, it's really, really affordable. Now, for the annual duration, if you're just an individual and you want to be on the standard JARA plan, just you, for a year, you can actually come on board for 15,000 naira, just 15,000 naira for an individual. But of course, if you want to come with your family, yes, father, mother, and 2 children, yeah. A family of 4, it's for a year, it's 55,000 naira. But a family of 6, father, mother, and 4 children, yes, you will be paying 80,000 naira for a year. But if you're doing a semi-annual plan, yes, perhaps you just want to do half a year. So every 6 months you renew. That will be for the individual. If it's just you're paying 8,000 naira. But a family of 4, father, mother, and 2 children, you're paying 29,250 naira. For a family of 4, yes, for the that's half a year, yeah. And if you're doing for the family of 6, it's 42,500 naira. Yes, yeah, I got that correctly. For the quarterly plan, if you're doing every 3 months, for the individual, it's 4,125 naira. Family of 4 is 15,000 naira. 15,000 naira if you're paying quarterly, that's every 3 months. But a family of 6 is 22,000 naira. Then if you are doing so for the monthly initial premium payment, which has to be 3 months lump sum. Yes, for the individual, it's 1.5. So that's it. If you're doing one month, which of course is 1 month, but you have to pay 3 months ahead at the very beginning. That's 1.5. But for the family of 4, it's 5,400. But you have to pay 3 months upfront if you're doing that. That's for first 3 months. Okay, and then for the family of 6, yes, it's 8,000 naira. If you're doing monthly, 8,000 naira, but the initial premium payment has to be 3 months lump sum. And you will agree with me that this is quite affordable, so affordable. And yes, if you want more information, of course, the numbers to call, you can reach out to the team at ILERA EKO. And yes, you can also reach out to us. We'll give you more information on how to get across to them, even as we bring things to a close. A quick breather and I'll be right back to round things up. It's still ILERA EKO Extra right here on Lagos Traffic Radio 96.1 FM. Don't go nowhere.
Carol, come on. You don't hear say Lashma don't bring V-Boots come with market.
Now who be Lashma?
Lashma na Lagos State Health Management Agency. The people will bring ILERA EKO.
Oh, okay. The social health insurance people. But what you come consign us with V-Boots?
Carol, V-Boots na the online store where subscribers fit get telephone healthcare talk with doctor. Dem don station all these V-Boot stores them for all the big area markets throughout Lagos. People wey don already pay down for the standard Jara plan go enjoy all the better benefits of the old standard plan together with the new extra jolliment.
Abeg, tell me say this talk na true.
Just dial *6700 *006 # to join standard Jara one time or call 0700 ILERA EKO. You fit also send WhatsApp message to 0704 535 8275 or register online for www.lashma.com. ILERA EKO, nobody go carry last.
There you have it. Yes, 0700 ILERA EKO. And yes, you can also call 090-6254-7015 or 081-640-031. Any of this will do, and yes, of course, someone will attend to you. You can also seek more information, by going to their website. Yes, www.lashma.com, and yes, if you just type online, type ILERA EKO, information will come, and then you'd be able to reach out to someone. But if you need more information, you can also reach out to us right here at the studio, and we'll be happy to connect you with someone who will definitely, take you on that journey. It's been a great time on the show. I hope I've been able to convince you that, health is not valued until sickness comes. So no one plans for this, but please, as much as possible, let's be prepared. That's all for today's show. Remember, good health is indeed the greatest wealth. Don't wait until sickness comes. Don't wait until that time to prioritize your health. Enroll in the ILERA EKO Standard Jara plan today and ensure you and your loved ones receive quality medical attention when needed. Thank you for tuning in to ILERA EKO Extra. A big thank you to Aden Kagbemibade, PAO Lashma, and also a big thank you to Victor Oteri. Until next time, stay healthy. And my name is Akan Usen, wishing you all the very best. Bye for now.
Wizard boy, shall I show it on this?